Breast cancer is one of the most common cancers in the world, making up 12.5% of all new cases reported each year and affecting millions of individuals. It doesn't make any distinctions according to age, gender, or race. It is not just a disease, it's a silent predator lurking among us, often concealed by myths and misconceptions. Addressing these myths is crucial because misinformation can cost lives. Since early discovery greatly increases the likelihood of a successful course of treatment and survival, the stakes are high. Busting myths gives people accurate information so they can make decisions about their health that are well informed. In this video, we will delve into common misconceptions surrounding breast cancer, unraveling the truth behind them. By doing so, we aim to give you the knowledge to navigate through the noise and take charge of your health. 1. Only women can get breast cancer. Breast tissues exist in both males and females, although it typically develops differently due to hormonal influences. While breast cancer predominantly affects women, men can also develop this disease due to the presence of residual breast tissue and similar genetic susceptibilities. The misconception may arise from the fact that breast cancer awareness campaigns predominantly focus on women, given their higher risks. Additionally, societal norms and gender stereotypes may contribute to the perpetuation of this myth, with men less likely to consider themselves at risk to seek medical attention for breast-related symptoms. From a biological standpoint, breast tissues in men is typically less developed, leading to a lower incidence of breast cancer. However, when cancer does occur in men, it tends to be diagnosed at later stages, possibly due to less awareness and screening. 2. Only older women are at risk. There persists a pervasive myth that only older women are at risk for breast cancer, perpetuated by outdated perceptions and lack of understanding. Medically and biologically, this misconception is flawed. While it's true that the risk of breast cancer increases with age due to cumulative exposure to risk factors and genetic mutations, younger women are by no means exempt. From a biological perspective, breast cancer can strike women at any age for a variety of reasons, including exposure to the environment, hormones, lifestyle decisions, and genetic predispositions. Younger women may also have aggressive forms of breast cancer, which can be particularly challenging to detect and treat due to the assumption that they are not at risk. Furthermore, while the incidence of breast cancer rises with age, it is vital to recognize that younger women can and do develop breast cancer. Ignoring this fact may cause delays in diagnosis and treatment, which may have an effect on results. 3. Breast cancer always presents as a lump. Contrary to popular belief, breast cancer doesn't always manifest as a palpable lump. While lumps are a common symptom, various other indicators can signal the presence of breast cancer. These include alterations in the size or form of the breasts, nipple discharge, skin puckering or dimpling, and ongoing breast soreness. Breast cancer encompasses a spectrum of abnormalities, each with distinct characteristics. While some cancers form detectable masses, others may spread through the breast tissue without forming a noticeable lump. This can occur due to the different types of breast cancer, such as ductal carcinoma in situ or inflammatory breast cancer, which may not always present as a palpable lump at the initial stages. Furthermore, improvements in imaging methods like MRIs and mammography have made it possible to identify breast cancer early on, even before a lump is noticeable. Understanding that breast cancer can manifest in various ways beyond a lump is crucial for early detection and effective treatment. Frequent clinical breast exams, screenings, and self-examinations are crucial for seeing any potential anomalies, guaranteeing prompt intervention and enhancing prognosis for breast cancer patients. 4. The only women at risk are those who have a family history of breast cancer. Breast tissue undergoes continuous changes throughout a woman's life. influenced by hormonal fluctuations and other biological processes. Regardless of a family medical history, these alterations may occasionally result in the growth of malignant cells. For example, while mutations in particular genes such as BRCA1 and BRCA2 can increase vulnerability, they are not the cause of most instances. Other genetic mutations and environmental factors such as exposure to radiation or hormonal influences also play significant roles. 5. Breast implants can prevent breast cancer. Breast cancer prevention primarily relies on factors such as lifestyle modifications, genetic predispositions, and early detection through screening methods like mammograms. Breast implants, which are typically made of silicone or saline and surgically inserted for cosmetic purposes, do not alter the underlying biology of breast tissue, nor do they impact the risk factors associated with breast cancer. Indeed, a number of studies have highlighted possible issues with breast implants, including a possible high risk of a rare kind of lymphoma called breast implant-associated anaplastic large cell lymphoma. Moreover, implants can sometimes hinder the effectiveness of mammograms, making it more challenging to detect breast cancer in its early stages. Relying on breast implants as a means of preventing breast cancer is medically unfounded and could result in delayed diagnosis and treatment. It's crucial to dispel such myths and encourage evidence-based approaches to breast cancer prevention and detection. 6. Antiperspirants and underwear bras cause breast cancer. The assertion that antiperspirants and underwear bras cause breast cancer is a persistent myth that lacks scientific substantiation. There is no credible evidence supporting this claim. Some believe that aluminum-based compounds in antiperspirants, which temporarily block sweat glands, may be absorbed through the skin and cause cellular changes leading to cancer. However, numerous studies have debunked this theory. The American Cancer Society and the National Cancer Institute have found no conclusive evidence linking antiperspirants to breast cancer. These substances are effectively processed and eliminated by the body's natural detoxification processes. Another unfounded belief suggests that underwear bras, by constricting lymphatic drainage, promote the accumulation of toxin in breast tissue, fostering cancer development. However, the lymphatic system efficiently removes waste and toxins from tissues regardless of bra type. There is no scientific basis to suggest that wearing underwear bras increases breast cancer risk. 7. Breast cancer only affects women with large breasts. Breast cancer is not determined by breast size alone. Instead, it is primarily influenced by genetic mutations and hormonal imbalances that can lead to the abnormal growth of cells in breast tissue. These mutations can occur in any woman, regardless in breast size, and can result in the development of cancerous tumors. Furthermore, breast size does not inherently increase the risk of breast cancer. While larger breasts may have a higher volume of breast tissue, that does not necessarily mean a higher risk of cancer. Conversely, smaller breasts do not guarantee immunity from breast cancer. 8. Breast cancer is a death sentence. Breast cancer is indeed a serious condition, but advancements in early detection, treatment modalities, and supportive care have significantly improved outcomes. The anxiety surrounding the diagnosis is one of the main reasons this myth endures. Although many people associate cancer with impending death, the truth is the survival rates have been rising over time. Regular screenings, including mammograms, enable early discovery and prompt action, which improves treatment outcomes and prognosis. Breast cancer is a multifaceted illness with different subtypes, each with unique traits and treatment outcomes. Additionally, advancements in surgical techniques, chemotherapy, radiation therapy, and immunotherapy have expanded treatment options and improved outcomes for patients at every stage of the disease. 9. You cannot take any action to lower your risk of breast cancer. First off, there is a substantial reduction in the risk of breast cancer by maintaining healthy weight with a balanced diet and frequent exercise. Excess fat tissue can increase estrogen levels in the body, which in turn can fuel certain types of breast cancer. Secondly, limiting alcohol consumption is another crucial measure. Since drinking alcohol has been associated with a high risk of breast cancer, cutting back on or giving up alcohol use can help lower that risk. Moreover, avoiding hormone replacement therapy or discussing its risks and benefits thoroughly with a healthcare provider before starting it is essential. Breast cancer risk has been found to increase with long-term usage of some HRT formulations. People can reduce their risk of breast cancer by adopting preventive healthcare practices and making lifestyle changes. Thank you for joining us on this journey toward a healthier you. Don't forget to subscribe and stay tuned for more empowering content on health date, because your wellness deserves a daily date.